Hi everyone, Gilliam Elliott here. In today's video, we're going to talk about something that every medical travel business needs to understand, but many people overlook, and that's protecting your business legally. We're going to walk through the contracts, disclosures, and professional boundaries that help protect both you and your clients. Now, before we get into this, I want to be very clear about something. I specialize in medical tourism, but I'm not a lawyer. Everything I'm sharing comes from my experience working in this industry and from our legal contracts for facilitators, which were created by lawyers. The international healthcare market continues to expand, and facilitators play a major role in connecting patients with treatment options abroad. But being a facilitator is about much more than simply introducing a patient to a doctor. You're often managing a large number of moving parts. That can include research, communication with clinics, transferring medical records, helping with travel arrangements, and sometimes even coordinating translators or recovery accommodations. When all of those moving parts come together successfully, patients have a smooth experience. But when something goes wrong, the question becomes, who's responsible? And that's where proper agreements come into place. Because the role of a facilitator can be so broad, relying on informal agreements or handshake deals is not enough. A key best practice to keep in mind in this industry is to always have everything documented in writing. Written agreements define your role, your responsibilities, and the expectations of everyone involved in the process. Think of these agreements as a roadmap. If something unexpected happens during the medical trip, you don't want to be guessing who's responsible for what. The agreement should always make that clear. This is especially important because facilitators are often viewed as professionals guiding patients through an unfamiliar process. Since the patient doesn't do this every day and you do, the law may expect a higher level of disclosure and clarity from you. Another benefit of written agreements is that they help manage expectations. Medical travel involves several different parties, and everyone needs to understand their roles before the trip ever begins. So at this point, you may be asking yourself, who exactly are these agreements with? In most medical travel businesses, there are three main relationships that need to be documented. The first and most important is the agreement you have with the patient. This is commonly called a patient service agreement or a facilitator-patient agreement. It explains the services you provide, and just as importantly, it explains the services you don't provide. As a facilitator, you coordinate care and travel logistics, but you are not a doctor and you are not the healthcare provider performing the treatment. Inside this agreement, there is typically a limitation of liability section. This is where the patient acknowledges certain risks and agrees not to hold the facilitator responsible for issues outside of the facilitator's control. For example, many facilitators help arrange hotels, transportation, and travel logistics, but those services are provided by third-party companies, not by the facilitator. Your agreement should clearly explain that those services are provided by independent businesses. If a hotel loses a reservation or a transportation provider is delayed, those issues are the responsibility of those service providers, not the facilitator coordinating the trip. Having the patient acknowledge that in writing is one of the most important protections for your business. The second type of agreement is between the facilitator and the medical provider. These are the clinics, hospitals, and surgeons you're referring patients to. Whether it's a one-time referral or a continuous partnership, there should be clear terms explaining how the referrals work, how payments are handled, and how patient information is transferred. For example, the agreement should clearly explain how and when the facilitator will be paid. Some facilitators are paid a flat referral fee, while others receive a percentage of the procedure costs. The agreement should also specify when that payment is due. A clinic might assume payment is due after the procedure, while the facilitator expected payment within 10 or 15 days after the provider received payment from the patient. These details matter. The agreement should also clarify how payment will be made, whether by bank transfer, wire, or another method, and who is responsible for the transfer fees. Spelling out these details in advance helps prevent misunderstandings and ensures both sides understand the financial terms of the relationship. Beyond the patient and the medical provider, there's another group involved in the medical tourism process. These are the service providers involved in the travel portion of the experience. Things like hotels, transportation companies, translators, or recovery accommodations. As mentioned earlier, facilitators often arrange these services, but it's important to understand that you do not control how these businesses operate. Because of this key nuance, some facilitators have working agreements with these types of companies to clarify responsibilities or service expectations. Okay, let's move on to the next topic, which is talking about the patients traveling after their procedure and the risks that are involved with this. There are different travel-related risks that patients should understand before they decide to undergo treatment abroad. For example, long flights can increase the risk of blood clots forming in the legs. This condition is called deep vein thrombosis, or DVT. Because of risks like these, Facilitators should include a written disclosure explaining potential travel-related risks associated with medical tourism. Another situation facilitators should address involves patients traveling with limited mobility or while taking medications after surgery. After certain procedures, patients may have difficulty walking long distances, climbing stairs, or moving easily through airports. Others may be taking pain medication, antibiotics, or blood thinners during their recovery period. Because of this, facilitators should encourage patients to speak to their treating physicians about when it's safe to travel and whether special arrangements may be needed. Documenting these discussions helps ensure the patient understands the reality of post-treatment travel. Even with careful planning, things don't always go as expected. Flights can be delayed, recovery timelines can change, and schedules may need to be adjusted. Part of being a professional facilitator is helping manage those expectations and preparing patients for unforeseen events. That's why many agreements include limitation of liability clauses. While these clauses can vary, they often ensure that if things don't go as planned, the facilitator only is responsible for refunding the fees they were paid, rather than the total cost of the patient's surgery and travel. This covers things like severe weather, transportation strikes, or natural disasters, and any major disruptions that interfere with travel or lodging. Including these types of clauses ensure that the facilitator isn't responsible for events that are simply out of their control. If you're looking for legal agreements for your medical tourism business, I'm going to leave a link to our pre-made contracts in the description below. But thanks for watching, and I'll see you in the next video.